Hello, my name is Tyler. I'm going to be your nurse today.
Hi Taylor, nice to meet you.
Nice to meet you. I'm going to go ahead and perform hand hygiene here. I just want to take a look at your badge. Can you go ahead and tell me your name and date of birth?
Brittany Rose Trofer, 3/15/1992.
Okay. And I want to assess your pain today. So the first, can I go ahead and, can you tell me on a level of 0 to 10, what is your pain level today?
A 0. I don't really have any pain. I'm just kind of here for a general checkup.
Okay, perfect. And so I'm going to go ahead and hold the blinds behind us. Make sure that we're keeping your privacy. And nextly, I'm going to go ahead and shut the door so that we keep a safe environment. Okay?
Okay.
All right. So for the first test that we're going to be doing today, I'm just going to ask you a series of questions. So to start out, can you go ahead and tell me your name again?
Brittany Rose Trofer.
And do you know what day of the week it is?
It is Wednesday.
Okay. And can you tell me who the president is?
It is Donald Trump.
I'm shocked too. And then lastly, can you go ahead and tell me the year?
It's 2018.
Perfect. Okay, so the patient is alert and oriented, ×4. Next, we're going to move on to your nutrition. Can you tell me what a normal day is like for your eating?
So I usually have oatmeal in the morning, and then for snacks I usually do like some sort of veggie or protein bars, and then I do like meat and vegetables.
Okay, so it seems like you eat a very balanced diet and that health is important to you. Would you say that's true?
Yes, very true.
So the patient's posture is upright. Her positioning is looking forward at me. Her mood seems in a good mood, not nervous at all about the situation of coming in for a checkup. And her speech seems to be fluent. It's regular pattern and appropriate. The articulation is appropriate as well. And okay, so next I'm going to go ahead and move on to another thing is going to be your personal hygiene that we're going to be assessing. So I just want to know how often you shower a week.
I usually shower probably every other day.
Every other day? Okay, and then how often do you brush your teeth?
I brush them twice a day.
Twice a day, and then flossing?
I floss usually at least once a day.
Okay, perfect. And next we're going to move on to the skin assessment. So is it okay if I touch you?
Yeah.
Okay, so I'm just going to be assessing. Let's keep it up so the camera can see. Just the patient's hands, looking for any lesions. The color is appropriate for race and pigmentation. I don't see any, on the rest of your body, I don't see any sort of lesions or deformities that I can see. Is there anything that I can't see on your hands or anywhere else?
No.
Okay, and then here it seems like the temperature is warm and appropriate. Patient's skin is not too moist. As she's noted, no lesions here. And I'm going to also be assessing for your turgor. So I'm going to be pinching here. Patient doesn't look dehydrated. I'm going to also go here. Perfect. There's no tenting of the skin, so patient is appropriately hydrated. Next, we're going to move on to the nails. So I'm going to be assessing your nails here, looking for any clubbing. The degree of the nail looks at 150 degrees, normal and intact. And then also the consistency of the nail seems appropriate. I'm also going to be checking your capillary refill, so do you mind if I go ahead and squeeze your finger here?
Go for it.
Alright, so let me go ahead, squeeze the finger, check the other hand as well, straight here, and it looks like the capillary refill is 2. So now we're going to be moving on to another assessment, is going to be the eyes. Okay, so everything so far is normal, nothing is out of the ordinary. I'm going to have you go ahead and first we're going to be looking at the external portion of your eye.
Do you
So,
need to close them?
no, I'm actually going to have you open your eye, and it looks like the conjunctiva is clear and normal. The cornea is intact. Pupil is intact. No little red blood vessels, but do you seem to be tired today at all?
Yeah.
Or is that kind of normal?
It's kind of normal.
Okay. And the iris is also blue. Sclera is white. So for the next thing I'm going to have you do is I'm going to have you stand up for me. And I'm going to have you scoot over here. Perfect. Keep you in the shot. Okay. So I'm going to go ahead and I'm going to have you cover one eye.
Mm-hmm.
And I'm going, tell me when you can go ahead and see my hand in your peripheral vision. Okay? 3, 2, 1.
Yep. Yep.
Okay, and then we're going to be switching. Same here.
Yep. Yep.
Okay. So it looks like it's normal for both sides. I'm also going to be looking at a test that we call an accommodation test. So I want you to go ahead and look at my pen here. And look at the wall behind us. Don't move your head, and right back at the pen. So the patient's pupils constrict appropriately. And then we're going to also be doing another test here that I'm going to have you go ahead and look straight at my nose. And alrighty. They constrict bilaterally. Perfect. And now I want you to go ahead and follow my pen, okay?
Mm-hmm.
So I'm going to go from here, just your eyes. Perfect. So that's going to be it for the eye exam. I'm just going to have you go ahead and sit down. And there's going to be one more thing we're going to be doing is just going to be, I'm going to have you look straight ahead at me. And both constrict. Seems like the cornea is good. Pupil size is a 3. So that's all normal. Okay? So the next part of the test we're going to be moving on to is the ears. So I'm just going to go ahead and take a look at your ears here. The auricle is intact, no lesions. The external auditory canal seems normal, no redness. We're also going to be looking at the lobe here. Typically, this is where I would go ahead and use my ophthalmoscope or an otoscope, and we're going to be looking at the eardrum or tympanic membrane, and that should be pearly white or gray. But we're not going to be doing that today because we don't have an otoscope, and so that would be the normal finding for that. And the next thing I'm going to have you do is I'm going to have you go ahead and close one ear, plug it, there you go. And I want you to tell me what word you hear. And I'm going to whisper it to you, okay?
Dog.
Perfect, and now the other side.
Dog. Cat.
Perfect. Alright, so the whisper test seems that you have good hearing bilaterally. Now we're going to be moving on to the next test here. And this next test is going to be we're just going to be doing your head, your face, and that's going to be where we're going to be starting, okay? So I'm going to be assessing the head, looking at the scalp. Doesn't note that there's any sort of lesions at all. Checking the scalp, cranium, hair. The hair seems smooth. Looks like you use a nice conditioner in it. A little different than my hair. And then, so that the head looks normal. I'm going to have you look straight ahead at me. Face is symmetrical. There looks like there's one scarring here. Mm-hmm. And was that from, when did you get that scarring?
When I was 8.
When you were 8, so quite a while ago.
It's been healed for a while.
Yeah, it looks nice and healed. So the face otherwise is symmetrical. And then I'm also going to have you go ahead and, do you mind if I touch your face?
No, that's fine.
Okay, so I'm going to be putting a little pressure here. Is there any tenderness there?
No.
Okay, good.
No.
Good. And I want you to go ahead and clench your teeth for me. Perfect. Then we're also going to be doing that here. clinch. Perfect. And so what I was just looking at was the frontal sinus and then also the maxillary sinus.
Got it.
So next is going to be another test we're going to be doing. I'm going to need to use a cotton ball and a pin. So let me grab those real quick. So I'm going to have you go ahead and close your eyes and tell me where the location of where I'm touching you is, and also if it's a sharp or dull pain. Okay? Ready?
Dull pain.
Perfect.
Dull pain.
Perfect.
Dull pain. Dull pain.
Last one.
Sharp.
Yes. Perfect. Next thing I'm going to have you do is I'm going to have you take a look at me and raise your eyebrows. Smile. Blow your cheeks. Perfect. So cranial nerve 7 is intact, and that's going to be completing the whole symmetry. We can see the symmetry here, but there's no ptosis of the eye or anything like that. Lastly, we're going to be moving on to the nose. I want you to go ahead and plug one nostril for me, and inhale, and exhale. The next side. Inhale, and exhale. All right, so the nostrils are patent. Okay, and next we're going to be doing the mouth and tongue area. So what I'm going to be doing is first I'm just inspecting the lips and the mouth. Typically I would have gloves on here, but for sake of time we're just going to be using my hands. I'm going to have you go ahead and open your mouth. I'm going to be looking. It looks like the buccal membrane is red, no lesions, no inflammation, perfect gums, there's no bleeding of the gums. Why don't you go ahead and stick your tongue out for me? Just stick it out, move it to the left, to the right, perfect. I have a tongue blade here, also going to be using. Go ahead and open your mouth and say ah. Perfect. Perfect. And that shows that cranial nerve is in fact intact. Next, we're going to be moving on to another examination of the neck. So I'm going to go ahead and put the tongue down. And so we're going to be doing your lymph nodes. We're going to start here with the periocular. I'm going to be noting they're free, movable, non-tender. Is there any tenderness here? No pain?
No.
Good. Periocular, postocular, occipital, submental, also clavicular, the deep cervical we're going to be moving on to. Also, and then I'm also going to be looking at touching the your skin for the carotid artery. So I'm going to go ahead and feel your pulse. Alright, so now next I'm going to test your strength. So go ahead and turn your head to the left. Perfect. Right. Up. Down. Go ahead and raise your shoulders up. And down. Up. And down. Alright, so we're going to be moving on to the next test. And because that's going to be finishing up that part of the test. Next I'm going to be going to the upper extremities. We're kind of working from the top going down. I'm going to be holding your hand here, and I'm going to assess your radial pulse. So here, normal radial pulse is going to be 60 to 100. I'm going to be doing this for a total of 30 seconds. Seems normal, but once 30 seconds has passed, then I would be able to go ahead and double the score. And then if it's within the normal range, then that's good. If not, then I'll go ahead and do it for the full minute. I'd also do the left side, make sure that there's normal bilaterally. I'm checking the amplitude, so this seems like a 2+ for the strength. Rate, rhythm is good. Perfect. So the next thing I'm going to have you do is we're going to be testing your strength. So I want you to go ahead and flex your arm and then push down. Same side over here. Flex. Push down. Go ahead and go like this. Go up and down. Perfect, like this. Push up and down. Out and in. Perfect. A little too strong for me. All right, next we're going to be moving on to the chest. So I'm going to have you go ahead, and if you can go ahead and sit with your legs facing that way.
Got a wobbly chair.
Perfect.
Oh.
Perfect.
Okay.
So I'm going to be going and checking the symmetry of your chest, looking at the traps, also the thoracic cage. The skin seems normal and intact. There's no real dryness or any lesions noted. I'm also going to be having you take a big inhale and exhale, and inhale and exhale. Perfect. I'm looking for symmetry of the diaphragmatic excursion. Next, I'm going to be also palpating the spine. So here I'm going down each vertebrae of the spine. Is there any tenderness noted here?
No, no.
And then I'm going to be doing this the last strip on the back. It's the costovertebral angle that we're going to be palpating as well. Any tenderness here?
Mm-mm.
All right. Lastly, I'm going to be auscultating the breath sounds on your back. Okay? So I want you to go ahead. I'm going to start going in a Z-line pattern. Go ahead and do a big inhale. And exhale. Inhale. And exhale. Inhale. And exhale. Inhale. So it's important to note I'm doing exhale, a whole inspiration as well as an expiration. Inhale. And exhale. Last one. Inhale. And exhale. All right, I'm going to go ahead and have you turn around and stand up for me, please. And so here I was going here, 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 just so that they can see exactly the Z-line pattern. I'm going to have you go ahead and sit for me. And I'm going to have you go ahead and I'm going to be assessing the chest area here. And I want you to go ahead and as the patient's sitting there, I'm going to look for respiration and note the depth of the respiration, making sure that it's even. If I tell the patient that I'm going to be assessing their respiration, they might change their breathing patterns and they might start to breathe quicker or even slower to try to be a normal patient, but in reality, this is the perfect patient as one that's not changing anything. And then I'm also going to be here palpating the chest. There's no lumps here, tenderness. If I do, if I can ask, do you check normally or annually or monthly any sort of signs of lumps on your breasts or anything?
Yes.
You do? Okay, perfect. And so it's important that if you do see or notice any irregularities, go ahead and inform us or call your provider, your family health care provider as well.
Perfect.
Nextly, now that you can see it up front, I'm going to be going and doing the same thing, but I'm going to be listening to the breath sounds of the lungs here. Go ahead and take a big inhale. Exhale. And inhale. And exhale. Inhale. Exhale. And inhale. And exhale. Inhale. Exhale. Last one. Inhale. Exhale. So it's important to note that I would typically go ahead and ask the patient to take off their shirt, but just for the decency of the patient, I'm going to go over the skin, and also over the shirt itself, and not right onto the skin for this assessment. And the next thing that we're going to be doing is checking the heart. So I'm going to be starting by checking the apical pulse here on the left-hand side. I'll be holding it here for 1 complete minute. Just to the lateral side of the left breast and inferior to the left breast is where. So we're going to be doing that for a total of 1 whole minute. All right. So next I'm going to have you go ahead and lean forward for me. So I want you to go ahead and exhale and inhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Alrighty. And I'll be doing the same thing to the front. So we're going to be starting here in the front. Just go ahead and breathe normally for me. So here I'm starting with assessing the aortic valve, the pulmonic valve, Ebb's point, the tricuspid valve, and then also the mitral valve. Looking for any bruits or whooshing sounds. Next, I'm going to be doing the same thing with my bell, so I'm going to be turning it over. Again, assessing for any of those sounds. Ebb's point. I'm also going to have you lean forward for me again and be checking the base. So go ahead and exhale for me. Perfect. So nextly, it'd be great if you could go ahead and lay on your left side here for me.
On my left side, like.
Perfect. Yep. We have a little bit of a wonky area here. And I'm going to be looking at the apical pulse. I'm checking the rate, rhythm, and again, I'll be doing that for 1 full minute. All right, next I'm going to have you lie on your back. So next we're going to be doing the abdomen. I can help you into the correct position.
There we go.
All right. Well, I have a big table here. So next I'm going to be doing and looking at the symmetry of the. We're good here. And I'm going to be doing the symmetry of the abdomen. Checking. It looks like it's symmetrical. No lesions or bruising that I can see. Also, the skin looks just like the rest of the skin. It looks intact and age appropriate. Next, I'm going to go ahead and be listening to the bowel sounds. So I'm going to start in your right lower quadrant. This is where we're going to be seeing your appendix. So if you have any irregularities with the appendix, I am noticing a little bit of bowel sounds, so the patient isn't hypoactive, also not hyperactive. It seems fairly normal and consistent. I'm also going to be assessing the aorta. Sounds down the middle here. So there again, no bruit or sounds like that, and when there's no tenderness when doing that.
No, no.
Okay, perfect. So now I'm going to be percussing the sounds. It's dull. Then move up to the right upper quadrant, holding the liver. Getting a dull sound on the left upper where the spleen is. Perfect. I'm going to be touching your abdomen here. We're going to be doing a light superficial touch. Palpating and no tenderness at all noted here?
No.
Okay, good. Any tenderness?
No.
Going around. It's important at this first time to be very soft and not going too deep. And if there's no tenderness noted, then we can go ahead and go deeper. So we're going to be going deeper here, again testing those organs. If there's any tenderness, thank you for being such a good patient.
No worries.
All right, and that's going to be it for that portion of the test. Okay. So I'm going to go ahead and we're going to be doing the lower extremities now. Typically it'd be good to put the patient on the bed again, but no, you're totally fine. It's you know what? Yeah, if we could just have you do that, that'd be great. So you can just sit on the back too, just so it's easier to see. Okay, so I'm going to be lifting up the pant leg. I'm going to be looking for the, looking at the skin. Is there any lesions that you can, or deformities that I can't see that are on you?
Nope.
Okay, perfect. I'm going to be looking at the hair also of it. It looks regular. It looks pretty even throughout. At this time, I'm also going to be looking for varicose veins and assessing if there's any signs of deep vein thrombosis. That's the main thing that is important for to be sitting down on the bed, so you can sit back on here. I know it's a little uncomfortable.
No worries. Thank you.
All right. So next, we're going to be doing I'm going to be palpating the dorsal pedis. Right here, that's also going to be another pulse that we're going to be noting, just like how we did the apical and the radial. And same over here, just on the top here. And then right behind it here, I'm going to be doing the posterior tibial, right behind this ankle bone here. Okay, and then at this time I'm also going to be looking for any signs of edema on the foot. I'm going to be palpating the skin for this. Does not seem to be any pitting edema, no signs of trace edema at all. If we did have pitting edema, that's when we're going to go ahead and do a scale of 0 to 4 based on the time of the pitting. But for her, it looks good. We're just going to be checking the other side as well. Perfect. And I'm going to have you go ahead and lift your leg up for me from the knee, I want you to go
Oh.
and push against my arm. So,
Got it, like up. Sorry.
Yeah. Oh, you're okay. And then down. And then up on the left, or on the right, perfect. And then down. Perfect. And lastly, I want you to go ahead and bring your foot back and try to go against my hand. And then forward. Perfect. And then same over here. I want you to go ahead and come back and forward. And the last thing I'm going to have you do it on here just so the camera can see. We're going to do the same thing. Just testing the strength of the lower extremities as we did for the upper extremities. I'm going to have you sit down and I'll make sure that the couch is okay. Go ahead and bring your leg up and perfect, and down against me for good balance. Up, down, flex your foot against my hand. Now just bring the, there you go, from the ankle. Now push that down. And then same over here. And down. Perfect. Thank you for being such a great patient, and that's going to be it for the health assessment part 2.